Introduction to anatomical movements, part 2. Today we are going to see about spinal movements, lower limb movements and facial movements. First we will see the spinal movements. First movement is forward flexion. Take your hand upward and bend towards your front side. Try to touch the floor. So this is forward flexion. Come to neutral. Relax. Keep your both the hands on the butt. Try to bend backwards. This is extension of your spine. Come to neutral. Turn towards this side. So next movement is side bending. Right side bending. Bend towards right side. Come to neutral and bend towards the left side. So left side bending. Come to neutral. So next is rotation of the spine. Keep your both hands like this and rotate towards your right side. Come to neutral. Towards your left side. Come to neutral. So next we are going to see hip movements, hip joint movements. So turn towards this side. First movement is hip flexion. Bring your leg forward. Go to neutral. This is flexion and extension. Take towards back side. Come to neutral. Okay. Turn towards this side. Next movement is hip abduction. Take towards outside and take inside. This is adduction of your hip joint. So next movement is hip internal rotation. Come to neutral. Hip external rotation. Come to neutral. So all the 6 movements in combination we call it as circumduction of the hip joint. So next we will see about the knee joint movements. Turn towards this side. So flex your knee at backward. Flexion of knee joint. Come to neutral. This is extension of your knee joint. Turn towards this side. And when talking about the knee joint anatomical movements, we have 2 more movements. One is abduction and adduction and the other one is internal and external rotation. This can be seen inside the bone. So next we will see ankle joint anatomical movements. So first movement is ankle dorsiflexion. Go to neutral. And ankle plantar flexion. Neutral. Next movement is inversion of your ankle joint. Good. Come to neutral. Eversion. Neutral. So next movement is anatomical movement of your toes. So toes we have flexion. Flexion of your toes. Come to neutral. Extension of your toes. Neutral. Do abduction of your toes. Neutral. Adduction of your toes. Neutral. So anatomical movements of temporomandibular joint. First movement is depression of your mouth. So in depression the model should open the mouth. So elevation is nothing but closing of the mouth. So next movement is lateral or side to side movement. You can do left side. Okay, relax. Then grinding or chewing movement. Relax. Next we will see the facial muscles and its action. So the first muscle is frontalis. Action of frontalis is elevating eyebrows or wrinkles on the scalp. Next is corrugator superciliae, frowning of eyebrows. Okay. Next is procerus, wrinkles on the nose, also frowning of nose. Relax. Next is orbicularis oculi, blinking of eyelids. Good. Next is buccinator muscle. Action is blowing action of mouth or chewing. Next is orbicularis oris, whistle action of lips. Relax. Next muscle is zygomatic major and minor. The action of zygomatic major minor is smiling. Relax. And also rhizoris and the two muscles zygomatic major and minor does the work expression while talking and smiling along with laughing also. Next is mentalis. Mentalis is used in sorrow or doubting expression. Relax. Okay. Next is depressor anguli oris, opening the mouth. Relax. The next muscle is levator anguli oris, which facilitates smiling action. Relax. And the last muscle is platysma, expression of sadness, surprise and horror. Relax. So I hope this video will be very useful for your academical purpose, and we have covered all the neck, upper limb, lower limb, spine and facial movements also. So we will see you in the further videos. Thank you.